There's an ongoing debate in Washington, D.C., and in many states about whether to add work requirements to Medicaid. So, how does this idea fit into the broader goals of the social safety net?
The goal isn't the work requirement, the goal is the work.
On this episode, we sit down with Utah Department of Health and Human Services Deputy Director Nate Checketts to hear the department's take on the recent push for work requirements. We also explore how to help more people feel empowered to pursue work as key to health and well-being. This is Defending Ideas. Defending Ideas is a weekly podcast produced by Sutherland Institute. On this show, we are committed to renewing the principles of common sense conservatism, making you a better champion of sound ideas. Welcome back to another episode of Defending Ideas. I'm your host, Nic Dunn, and this week we're talking about federal safety net reform once again. In particular, we want to focus in on Medicaid a little bit because it's been in the news a lot lately at the federal and state level. And to have this conversation, I'm very excited to welcome into our studio Nate Checketts. He is currently the Deputy Director for the Utah Department of Health and Human Services. Nate, welcome to the show.
Yeah, thanks for having me. Looking forward to the discussion.
I appreciate you coming on, Nate, because this safety net reform in general, it can be a complicated topic, but also really important. And here in Utah, we're kind of in a unique position because every conversation I go into that's interacting with folks in other states, people point to Utah as kind of the model, the gold standard. Still plenty of ways we can improve as a state, but there's a strong recognition that Utah does things in terms of safety nets and helping people get out of poverty and stay out of poverty in just such an elevated way. So I love having these conversations because it's very much a good to great kind of mentality. And that's kind of what I want to talk to you about today as well, because Medicaid in particular has been in the news on the national level quite a bit. Of course, there's a lot of debate around the provisions in the budget reconciliation bill. It's been working its way through Congress and how that'll impact Medicaid. But also folks here at the state level, you all have been looking at some things, in particular, this question of work requirements for Medicaid. And the state actually here in Utah, Department of Health and Human Services signaled its intent to pursue a federal waiver to be able to incorporate work requirements in Medicaid for a targeted subset. We'll get into maybe some of those details, but I give all that context to maybe say, could you start us off by just kind of giving an overview of what's the department's approach currently to this specific reform of looking at how to further elevate and incorporate work and civic engagement as a part of the Medicaid program?
Yeah, as a department, we're always looking to help Utahns advance their health and well-being. And the Medicaid program is a significant part of that, especially for our low-income individuals in the state. There's over 350,000 individuals in Utah that are on the Medicaid program. And a lot of people may not realize that many of those enrollees are actually children. That's our largest enrollment group is our children. We also have individuals with disabilities, older adults, pregnant women. And so we have a very broad population on the Medicaid program. Focusing in on more recently, we've had the Medicaid expansion population, which covers adults 19 to 64, and have had a different population there. And as you mentioned, one of the issues that's come up in our state in the past and also now in the federal discussions has been related to the work requirements. When Utah pursued its Medicaid expansion, that was something that was required by the legislature that we consider a work requirement. We actually went through the process as a state to get that approved and actually implemented that in 2020 when we implemented Medicaid expansion. But before that requirement could go into place, the COVID pandemic hit and changed Medicaid work requirements or changed continuous eligibility. And so in doing that, we stepped back from that requirement. And now we're here again looking for the opportunity to be able to re-implement that as was originally designated by our legislature.
Nate, can you talk a little bit about, again, as we've said, there's some debate around this. It's an issue that's been debated many times over the years. What is sort of the argument? Well, I guess let me back up for a minute. What specifically are you trying to do as a state to implement work requirements? Can you talk about kind of who it's targeting? What are the provisions within it? Kind of what are the requirements you have to comply with? And what do you hope is the result? What do you hope to accomplish from it?
Yeah. So as I mentioned, there's a broad range of individuals on the Medicaid program. This is really targeted, again, for that Medicaid expansion group, where we're really looking to work with able-bodied adults. And while Utah's Medicaid expansion program has 70 to 80,000 individuals on it right now, a lot of those individuals are in circumstances where they really aren't in a position to work. They either have significant substance use or mental health issues. Maybe they're taking care of a dependent child, or are at an age maybe where work maybe isn't the right pathway for them right now. So our Medicaid waiver proposal actually has a significant number of exceptions or exemptions for those individuals that are in difficult circumstances that really aren't in a good place to be working right now. But for those for those remaining individuals, our goal really is to help them find work, to be able to change their life and be able to have the advantages of having work in their life. We've all had that experience where we had a productive job, had a productive environment, where that's contributed to our health and well-being. And so we think that being able to help individuals obtain work and maintain work is an important part of being able to do that. And that's actually one of our challenges as an organization and as a state. If we implement a work requirement, the requirement itself does add a burden or add a requirement for individuals to do things, but the goal isn't the work requirement, the goal is the work. And so how do we translate that in our efforts? What supports do we provide to help individuals actually move from a requirement to actually work and have those benefits that work can bring?
There's something you're touching on that stands out to me, this idea of, and you used the phrase at the beginning, health and well-being, that I think it's important to emphasize that it's, as you said, like for each of us, the provision of health insurance that may, I get through an employer by being employed is obviously a wonderful thing. It's a blessing. It's great and important for my family. But also my well-being extends so much further than just the fact that I have health insurance. It's my employment. It's my engagement with the community. It's my ability to do something that adds value and to society and empowers me to provide for my family. So I like this framing of it's about health and well-being, that's kind of this aspirational goal that I think sometimes gets missed in some of the debates and some of the concerns around work requirements. And in particular, maybe just to ask you to kind of clarify a couple of things for folks out there that might be concerned about this, that some of the pushback that I've seen at the national level and here at the state level in Utah and in other states is that, work requirements for Medicaid, there's this concern that are you going to sort of harm vulnerable people or push people who really need it off of the program? And based on what you're saying and the documents, we'll include in the show notes some of the material the department's put out. That's really not the case. It's really intended to, in my view, and I'd love to hear you expand on this, to sort of preserve and protect Medicaid for the vulnerable populations, folks who need it, and this other population that is using it, but as you said, as able-bodied adults who otherwise could be working or engaging in some way. And I wonder if you could just maybe help answer some of the concerns that folks have raised of, is this going to negatively impact people that we would want to be able to impact Medicaid versus kind of who it's targeted to and why work is, I would argue, very much a part of health and well-being.
Yeah, and I think it's important to restate and clarify that individuals with disabilities, older adults, that are 65 plus, those groups are not being asked to have this work requirement. Now, while work may be something they may want to do, and we actually have programs that say, look, if you want to work, we're going to try to help you do that. Because again, we see the value to have someone engaging in work if that's where those individuals want to be. But they're not going to be subject to this requirement. It really is for individuals that are at certain stages of their life, can work, and in many cases, Medicaid is a transitional program for individuals. If it's truly income-based, there may be periods of your life. I believe you had Representative Kennedy on earlier who talked about how his family went through certain phases of their lives where they qualified for Medicaid based on income, and then they moved off the program and went on to other coverage and care. And that will be the pathway for many Utahns. And so how do we help them as they're going through that journey to go from a time where they're going to need this public assistance to be able to get their health care to a time when in the future where they won't need that assistance.
Medicaid being a transitional program, I want to focus on that for a minute, because I've said on previous episodes where we're talking about safety net reform and upward mobility that in my view, I kind of want to test this against you and see what you think, that the safety net overall, so all the programs together, we should be better at articulating the broad goal of the social safety net, which is to provide some temporary stabilization for families who are struggling stuck in poverty, down on their luck, while helping them move towards work-based self-reliance, that it's help them in the short term, move them towards work-based self-reliance. That should be the broad goal of the safety net, and that should also sort of trickle down into each of the individual programs, including Medicaid, which I think bolsters what you're saying, that it's a transitional program as you're sort of earning more, getting to the point where you're kind of earning out of Medicaid either into private insurance through an employer, or we'll talk about maybe in a minute the subsidized insurance available through the federal exchanges. But it is, or should be in my view, temporary stabilization that's helping people move towards long-term work-based self-reliance that should be the entire goal of the safety net. How does that strike you? Is that the right message? Would you refine it at all? And if so, how can we sort of implement that idea in some of the reforms we're talking about?
Yeah, and that's one of the complexities of the Medicaid program, because for some individuals, it is where they're going to receive their care. Again, individuals with disabilities, individuals in nursing homes, we are their primary source of funding for their care. And that probably won't change in the future. But for so many individuals, it is a transitory part of their experience. And when they are down on their luck, when they are lower income, it's there to make sure that they can get care. We don't want to leave them as a society as not having an option to be able to get the health care they need. If they go into it, they should be able to go to a doctor, get their cancer treatment, get their diabetes drugs, those sorts of things taken care of. But then as their life situation changes, we talk about children, they won't remain children forever. As they get older and move on and get their own jobs and begin their lives and careers, we'd hope that they would be able to get coverage outside of the Medicaid program.
Nate, one thing on work requirements that I've wanted to ask you, just because this has come up as well in some of the news coverage, then I also want to get to some bigger picture aspects of Medicaid and reform and everything. But one of the critiques or fears that has been expressed is that even if we're talking about this targeted population again, that these able-bodied adults, that from an administrative standpoint, sort of the logistical compliance with a work requirement, there's some who are worried that it's sort of too much to comply with, and so people will sort of drop off just because of the administrative burden. I know the department has been taking public comment, has received that, and some of your folks have said, look, we want the public input. That's good because we want to improve this. I'm curious how you would respond to sort of those administrative aspects that to me would actually argue for the way we implement a work requirement matters. We want to make sure we do it in a way that's logistically efficient and workable for the folks on it, obviously, and actually encourages work, as you said. It doesn't seem to be an argument to not do it at all, but as far as the implementation, I'm just curious, how would you respond? Is there a way to sort of reassure folks that might be worried about the administrative side of things?
Yeah, I appreciate you bringing up the 30-day public comment. We just completed that public comment period, and that was one of the things that we were seeking input from the public on. If we're going to do this, and as we step forward to do this, how can we do it in a way that has the minimum burden on the individuals to, if they do have an exemption, to help show us that they have that exemption, or if they do need to meet the requirement, that it's actually leading to work and it's not just leading to administrative busy work. So we did get a lot of feedback on that. We're looking at ways that we can use our administrative data to do some of those designations so that people may not even need to submit anything to us. We could just determine that through our eligibility system. We're looking to do things through doctors, through self-statements, attestations, or statements from individuals to see where those are appropriate in the process. And then when we actually go to the requirement itself, Utah's requirement involves that individuals would go to the Department of Workforce Services and go through a sort of an assessment on what their skills and abilities are, and then take targeted trainings related to that, where if they say, maybe my resume isn't so great, I need some help on building my resume, that they would take a targeted training on that, and then go through a certain number of job applications. And that's actually a little bit of a different requirement than what's coming through on the federal level, is through the Reconciliation House bill, where their requirement is more targeted at 80 hours in a month that an individual is doing work or work-like activities. And so that's one of the things that we're considering as we're wrapping up our public comment process, and now we'll turn next in the next month or so to submit a request to the federal government, is do we modify Utah's request to take into account the discussion at the federal level of that 80-hour requirement.
That actually brings up the good point, because sort of this debate, if you will, is happening simultaneously on the state level and the federal level. And as I see it, I'm very pro Utah, pro federalism, and obviously the federal government plays an essential role in these issues. They're federally funded programs. A lot of the positive reforms need to take place ultimately at the federal level, but it's really fulfilling in a lot of ways working on these issues from the vantage point of being in Utah, because we have the one-door model that we talk about a lot on the show. We have sort of this renowned upwardly mobile economy. There's all kinds of awards of best managed state, and even the way we run these safety net programs are just is something that sort of stands out as a testament to Utah. And like I said before, there's of course ways we can continue to improve, but I guess one of the things that I would be a little bit worried about, that I'd love to hear your thoughts on, is I really like the idea of Utah as a state being able to move forward with elevating work and connection with work and civic engagement for the safety net generally, and with Medicaid specifically, implemented it in the right way like you're describing. And so is my concern unfounded that if the federal government passes or includes a Medicaid work requirement in the reconciliation bill, does that hamper Utah's ability at all to be flexible? Are there ways that if it does pass at the federal level, it could be done in such a way that states like Utah can still have some, I guess, nimbleness, if you will, to be innovative? Because to your point, I mean, just the integration with workforce services here in the state, I think, man, Utah is incredibly well positioned to help this targeted able-bodied subset of Medicaid to connect in a stronger way with work and civic engagement in a way that's truly productive and efficient, sort of this constructive approach. I don't want to lose that ability as a state if things happen on the federal level. So any thoughts of, is there a way, I guess, to thread that needle in a way that checks all the right boxes?
Yeah, and that is the discussion right now in Congress. I mean, the House has passed its bill and has set a mark on what it wants Medicaid work requirements to look like. The Senate's in the middle of those discussions trying to figure out if they're going to take that recommendation or amend it or change it in some way. So we've been in contact with our congressional delegation and their staff to talk about what we're doing in the Utah request and what we think the Utah model looks like. Part of our hope is to help influence that national discussion and say, hey, are there good points that you can take from what Utah's doing? We don't know yet at this point if the federal law is going to dictate to states and say how tight that's going to be. Are they going to be very prescriptive and say all states have to do it this way? Or will they leave some room for flexibility to allow states to implement in a way that maybe is most effective in their unique area?
Well, I hope those are constructive. We, of course, lend our voice on this show and other things we do at Sutherland to support that. Again, federalism, the ability of Utah to be able to execute well on its great track record and continue to make some improvements. I want to shift gears a little bit and talk about another area of potential reform, something that we've talked a lot about on the show previously and has been a big focus area for us here at Sutherland Institute, and just this idea of benefit cliffs. And we've had a wonderful experience working with the folks at Department of Workforce Services, again, very forward-thinking, just the state overall, in particular our state agencies that want to sort of continuously improve. That Utah, we already ranked number one for upward mobility and number one or near number one in so many areas. But there's this constant idea of, well, we want to keep on getting better. And even if we have broad upward mobility in the state, there are pockets of folks who still struggle. And we want to make the American dream more within reach for those folks as well. It's one of the things I love about working on opportunity issues here in the state. And what we found when we looked at the benefit cliff issue, there's a recap for our listeners, but we surveyed safety net participants in Utah statewide to just get a sense of what their experience has been. These are current or recent participants in the safety net. And some of the data points that we found, just to recap for our folks out there, are that of the survey respondents, 43% said that at some point they'd turn down an economic opportunity of some form because they were worried about triggering a benefit cliff, which again is that this fear that, well, a small increase in my income could trigger a larger disproportionate reduction in benefits from one or multiple programs. So 43% said at some point they've constrained their income, limited their growth because they're worried about that. How that manifests specifically in different behaviors, the three most common behaviors were 29% who said they decided to stop looking for or pursuing opportunities. So kind of a plateau effect, if you will, at almost a third. 19% said they worked fewer hours than were available to them. And in fact, we had a woman named Marcella on the show a while ago, talking about her experience, that's what she did. She felt like she had to kind of limit her hours for fear of triggering a steeper reduction of benefits. And then another 13% said they had turned down an actual offer for a job at some point. So again, I give those numbers kind of a recap for our listeners, but it does tie into Medicaid specifically because the two programs that stand out the most are food stamps, a SNAP program, and Medicaid. Just folks they don't want to lose these programs, and they're worried about earning more and sort of getting kicked off before their income can cover the difference. And so when we asked folks about that specifically, we asked, just generally speaking, were safety net participants in Utah aware of other resources that could be available to them if they lose benefits due to earning too much? And only 10% said that they were aware, generally speaking, of what other resources could be. But then we asked medical assistance folks specifically, so folks on Medicaid and CHIP, if they were aware that, hey, if you lose Medicaid, you'd be eligible presumably for something on the federal exchange, healthcare.gov, some kind of subsidized health coverage. And 40% of medical recipients said they were aware of that. So not a majority, but still a decent chunk of the users of the program. And then of those who were aware, we asked, does transitioning from Medicaid to the subsidized health insurance exchange, is it easy, affordable, efficient, and a suitable next step after losing Medicaid? And 43% agreed, said, yep, that's a good next step for me. 36% disagreed, and then 20% said they don't know. So it's kind of a little bit mixed of kind of people's experience with that transition. And sorry to kind of maybe bore our audience with a bunch of data, but I give all that context just, again, in the context of the things that Utah already does so well, the strides that Utah is making to further elevate work in programs like Medicaid. But just this recognition that for some folks, that they feel like there's a point that, well, I can't earn more, I can't earn too much because I don't want to lose Medicaid. I'd love just your kind of broad reaction to that with respect to the Medicaid program specifically, because it seems like there's a transition question. How do we help people, I guess, not feel so afraid that they can take work opportunities and still have access to what they need? So let's start maybe with general thoughts to that just barrage of data points right there.
Yeah, those, in a lot of ways, those are hard numbers to hear. I mean, we talked about, for many people, we expect this to be a transitional program. And you're highlighting that for them, they didn't see an opportunity for transition, or they saw a barrier to transition. And so I think it gives us something to work towards. So I appreciate you sharing those numbers. I think those are something we should keep an eye on as a department as time goes forward. There's a couple different things we can do related to that. One is, how are our programs structured? Are there programmatic barriers that are there? And then also talking about education, like making sure that people are aware. So on the programmatic side, we actually have a variety of different programs that can help people with that transition. You've mentioned the marketplace several times. So the Affordable Care Act created the expansion and the marketplace. There is an opportunity for individuals that are over income. They do get an automatic, so if they are closed or denied in the Medicaid process, there is an automatic referral that goes to the federal marketplace to kick off that process. So electronically, we sort of help them kick off and start that process. There's also other programs that the state of Utah has identified that we run on our own that maybe aren't available in other states. So one of the places that people could go after Medicaid is maybe they're getting a job and have employer-sponsored insurance, but then they're facing premiums and copays and some other things that they haven't had to face before. And so we have a program, Utah's Premium Partnership, where we actually help them pay for those costs when they go to work. So that's a way that we level out some of that cliff for them. So as they leave Medicaid, they're not going to no support, but they can use the Premium Partnership to help offset some of their costs as they go to their employer-sponsored coverage. Also, several of the Medicaid programs actually have some continuous eligibility periods. So let's say you were approved for Medicaid because your income was low, and fourth month in, your income goes up, and you're a postpartum mom or a child. There's several of these programs that have these transition options. We actually continue your coverage out through the 12 months, even though your income has gone up in the middle. So that transition period, again, sort of helps level off or smooth out some of that cliff. So we have a couple programs available that help us in that area. But as your survey results show, there's a gap there as far as education understanding. And so I think that's a challenge for us and our partner, Department of Workforce Services, to communicate that better to our Medicaid members. And you mentioned SNAP too, that how these programs work, and that there are some options for them, so that there's not this fear or this lack of understanding that if they were to take additional hours at work or a promotion, that might leave them without an option for health coverage.
I love so much of what you're saying, because it really is oriented around this idea of empowerment, and hearing kind of that list as the important recognition. There's a lot of stuff we're already doing as a state to help strengthen that transition, and even between DHHS and DWS, just help strengthen the transition overall, sort of off of these programs generally into work-based self-reliance. And in a lot of ways, if to the extent that it's mostly an awareness gap, if that's the case, that's in a way a much better problem to have, because helping to inform people and connect them with the resources that are there, I would assume can yield quicker benefits than maybe trying to build a program from scratch or expand programs. And so I like this idea of, we obviously want to do more as a state to help inform and educate folks on the things that are out there. One of the great things that I'll give a big shout out to the state legislature here in Utah, our governor's office, administration, Office of Families, and DWS, and DHHS being involved in these things moving forward as well. But in this past legislative session, the legislature appropriated $6 million in TANF funding for a pilot program to essentially help families better navigate some of these questions of, as I earn more, what effect does that have to my benefits? Am I going to be better off or worse off? And so I'm really excited to see how that moves forward to help, give families a better sense of what does the future look like? How can I financially forecast, if you will, as my income goes up, and how that affects my benefits, with some additional community-based coaching or mentoring of some kind, and also collecting robust data. I'm excited about that because, again, it's just, I kind of put all these things together in context of Utah already has a very pro-work approach to these programs. We're trying to elevate that through things like the Medicaid work requirements. We're trying to strengthen the transition through some of the things you've mentioned, but we're still we want to continuously improve. And so I guess maybe I bring all that back to the federal conversation that, again, our theme of good to great here in Utah. We can always improve, but we're doing things a lot better than a lot of other states, frankly, when I'm in some of these conversations with partners around the country. And so I guess my hope is that folks on the federal level can see the good things happening in Utah, that it's pro-work reforms. We're also sort of actively trying to address benefit cliffs or fears of benefit cliffs and help people transition. So how, as we start to wrap up, maybe pulling from all of that, what are some key messages that you've seen helpful in the department's discussion with partners here in Utah or at the federal level? What are sort of the talking points we should be using to help those ideas percolate in the state and up at the national level, so that these reforms, state or national, can again check these boxes in the way that we want them to be pro-work and empowering and smooth transitions and those kinds of things? What are the big things we need to remember and articulate as we're engaging these discussions with folks?
Yeah, I think going back to the goal of trying to reduce the benefit cliffs and ease these transitions, we continue to work with our partners on that. So the Department of Workforce Services does our eligibility determinations, has those direct communications with members related to eligibility, and also runs the employment assistance programs. So making sure that they're part of those discussions, wrapping in the work that they're already doing with the Food Stamp SNAP program. A lot of the requirements that were initially designed for Utah's program were based on that work, so not duplicating efforts, but building off of those same efforts. I mentioned earlier the analysis and assessment that's done. Those are already building on what we have available to Utahns through the SNAP program. And then being able to communicate that well with our partners. We work through with a group, Take Care Utah, that helps. Has been designated to help individuals understand about the marketplace and be able to enroll in the marketplace. And so we've had contracts with them and different opportunities to work with them to help make sure that members, Utahns, understand the options that are available to them.
Well, Nate, we've got just a couple minutes left, and maybe to close things off, I'd love to get your take on sort of the bigger picture. What kinds of reforms should we be thinking about as a state and nation? From time to time, people suggest block grants for things like Medicaid or similar things to that. They often look at the TANF program, Temporary Assistance for Needy Families, that has that format. And so I'd love kind of your thoughts for our folks out there that if we're just thinking big picture, how can we continuously improve these programs as a state And maybe I'll frame it this way. I like doing kind of my elevator question of, if you're standing on an elevator and in walks the president and congressional leadership, followed by Governor Cox and legislative leadership, and if they all say, "Hey, Nate Checketts, we saw that podcast interview. You're super great. How do we improve Medicaid? What if we could do anything as a state, as a nation? How do we make this program better in context of all these other programs to achieve the broad goals that you so well outlined at the beginning? What's the first big thing we should be thinking about doing?"
Yeah, so two questions really there. There's sort of like, how do we deal with the block grant per capita cap concept? And what are we doing great and what can we do best? Let me take the block grant concept first. So many of the funds that we do receive as state are block granted. And for some of the programs, that is a good fit. There's some issues that come up with trying to block grant Medicaid. One of them is that the population that are on Medicaid changes dramatically based on the economy of the state and how things are going. So we look, and the federal rules that are in place. Utah's Medicaid program grew to over 500,000 individuals enrolled when we had continuous eligibility during the pandemic. And now it's back down to the more common level of around 350,000 individuals. So a pure block grant struggles to be able to handle that type of fluctuation. And Utah's Medicaid program has always, when the economy's been well, enrollment has gone down. When the economy has not been good, enrollment has gone up significantly. So this is why there's this concept of what per capita cap is the way that it's talked about on the state and national level, that allows for this sort of adjustment to say, as population changes, the amount of money that a state would get would also change. And that seems to be a better fit for the Medicaid program than a traditional block grant. The other concept that is often brought up related to the per capita cap is a factor for inflation. We know that inflation exists across our country, but medical inflation historically has been higher than the cost of overall inflation. And so to put a program without having some adjustment for that could eventually cause that to constrict the program and not allow a state to be able to provide the services it needs for individuals with disabilities, for children in those groups. So most of the per capita cap discussions have some sort of concept in there for an inflationary adjustment. And in that environment, Utah actually put forward a request for a per capita cap waiver that included those types of factors in there back in 2017, 2018. That wasn't approved by the federal government. It didn't match where they were wanting to go or what they felt like they could approve. But it is within the realm of possibility with the right provisions and the right flexibilities for states. One thing that has not been included often in those discussions, the money is limited, but they often don't give states additional flexibility when they limit the funds. So it doesn't prove to be a way that actually states can help their citizens more in that environment. So just some things to consider there. Elevator pitch to the leaders of the state, the nation, about what can we do and what are we doing well and what are we planning to do related to this. One of the things is that we continue to seek. We pay a significant amount of money in this state for the Medicaid program. And how do we make sure that we're getting the right quality for our members? We often pay out a lot of our funds out through to managed care plans or to hospitals. We are starting to include more in our contracts with them some metrics that say, look, we're really interested in seeing how our members' health improves when we pay you all these dollars. And we're actually starting to hold back a portion of our funds, and it's a small percentage right now, but a portion of those funds to say, we will only pay those out if the members are experiencing the good health results that we're seeking together. So those quality payments, I think, are something that we're using and working with our partners to try to make sure that we're getting the services that we're paying for with them. We all know that drugs are important. The prescription drugs are an important cost driver in what's going on. Utah's operated a preferred drug list for many years that's allowed us to negotiate deals with manufacturers and say, look, if you give us a great deal on this drug, we'll put it on our preferred drug list. And it's resulted in a significant number of savings for our state, and we're actually implementing some additional changes related to that this year. So those are a couple of things that we're working on to try to make the program more effective, better able to serve Utahns and those that are on the program.
Well, Nate, we're at time. I'd love to keep this conversation going because this is such an important area of policy that intersects with people's health, their well-being, and their ability to, again, sort of be empowered to live their version of the American dream. And so appreciate you coming on and sharing, helping us kind of make sense of some of the discussions at the national level and better understand some of the efforts here at the state level to continue to improve these programs and the good things that are already happening. So just really grateful for your time and expertise with us on the show today.
Yeah, thanks for having me on, and thanks for sharing some of those statistics on the survey that you've done, and we look forward to speaking more about them in the future.
Well, once again, that's Nate Checketts, Deputy Director for the Utah Department of Health and Human Services. We're going to take a quick break before we leave you with some final talking points. This is Defending Ideas. We'll be right back.
Sometimes it's hard to keep up with the latest policy debate that affects your life. The solution? Subscribe to Sutherland Institute's weekly newsletter, where you'll find in-depth insights from seasoned policy experts, compelling multimedia, and advance notice of special events. Visit sutherlandinstitute.org.
Welcome back. The debate over work requirements will continue, of course. So if you and I find ourselves in a conversation about the issue, here are some key messages I think you can use. First, the overall goal of the social safety net should be to provide temporary help to people in genuine need while equipping them to move toward work-based self-reliance. This is a sound idea that I think is broadly popular among most Americans, and it should apply to Medicaid as well. Second, the ultimate goal should be supporting health and well-being, and a connection with work and engagement with the community is an essential component of that for a family. And third, states like Utah should be empowered to pursue these kinds of reforms in a way that's pro-work, but also addresses disincentives that people experience, like benefits cliffs, and is carried out in an efficient and effective way. I'm hopeful that the reform conversation at the state and national level will reflect these principles, and I'm encouraged that Utah's leaders are already doing a great job of advancing these sound ideas. Well, that'll do it for this episode of Defending Ideas. If you enjoyed this discussion, please visit defendingideas.org, where you can access previous episodes and watch or listen on your favorite platform. Don't forget to subscribe to Defending Ideas on Apple Podcasts, Spotify, YouTube, or wherever you like to get your shows, and make sure you share this episode on your own social media profiles or with a friend, family member, or coworker who may find it interesting. And lastly, if you want to support the broad work of Sutherland Institute, if you want more conversations like this, please make a contribution at sutherlandinstitute.org/donate. Thanks again for joining us on Defending Ideas from the Sutherland Institute in Salt Lake City. I'm Nic Dunn. We'll see you next time.